everybody, and welcome back. And thank you guys so much for coming to the panel where you are going to now hear from the real experts living with LGS and seizures and developmental and epileptic encephalopathies and rare disease. And I'll explain myself in just a second. So I have on this panel 6 amazing advocates that have decided to step up. All of them are caregivers and loved ones, not just of LGS. We have a special guest with us today that I'll be talking about in just a minute. But our problems are so similar. You know, the science might be different about our disorders in the severe epilepsy community, but we all are united under, we're all seeing the same doctors. We all have the same problems. And so this is really a panel of caregivers that, one is a representation of our community of support, first of all. We don't only have the LGS community of support, but we also have a broader community of support, which includes the severe rare epilepsies. And Emma Knott is here from Hope for Hypothalamic Hamartoma. She's going to be talking about that and her journey with that, which you'll find is very similar to ours. We also have a larger rare disease community. LGS is a rare disease, and all of us that are living with a severe epilepsy are living with a rare disease. But there's a larger group too out there where we all come together and really try to push for better treatment and care for our unique rare diseases. And this is a representation here of our LGS community of support and our broader rare epilepsy community support, where you can come and you can ask questions. A lot of the questions that I get answered that I have about living with LGS actually come from our online support group at the LGS Foundation. It's other moms and dads and grandparents and siblings and others who are living with this that can tell me the life hacks of how to deal with that. So I hope in this session you get a chance to meet 6 amazing advocates that are willing to tell their story, which is always really hard to do. And I hope that you'll feel like there's a broader community out there that you can go to for support. And I also hope from this session you learn some life hacks about maybe ways that you can deal with what you have going on because somebody else has been there before you. So we're going to jump right in. I think we're going to just go one by one. We're going to start with Ruben Salazar Jr. here. He can unmute here in just a second. And I'm just going to interview each person for a bit of time and ask them about their LGS journey, ask them some specific questions, or in Emma's case, her HH journey. And then I'm going to invite you all to ask questions. If you have any question of our panelists that you want to type into the chat, please do that. So with that, I think we should get started. So Ruben, welcome. So this is Ruben Salazar Jr. And if our last names look similar, it is because we are married. And this may be the first and last time we do a panel together. We'll have to see. We have been together for 30 years, and we have a 27-year-old who has LGS and other children as well that we love and adore. But it would be great if, Ruben, if you could just tell us a little bit about Savannah and about how you experienced her LGS journey and getting diagnosed.
One word, a hurricane. That's what it's been like. Everything after Savannah had her seizure, we were, like Tracy and I, we were lost, scared like everyone else because we had no idea. This is, many years ago. But the journey's been challenging, whether it's with schools, medication, dealing with doctors, dealing with the public. It's just a combination of a lot of things, even her service dog. I mean, there were places that didn't want us, Savannah, to take their service dog inside their business or their vehicle, especially cab drivers. But yeah, good luck with that one. That one didn't work long. But yeah, so it's been a big journey. Every day it's a crapshoot. We do every day, every morning. I'm sure, like a lot of parents also, is the first thing that we do for Savannah is to check that she's still alive. Is to see her breathing. And so I get up with my flashlight without trying to disturb them, and I check it. I look for the rise and the fall of her chest, make sure she's still good. I make sure that she isn't blue. But that's the card that we were dealt, and that's the card that we're going to play. And yeah, at the end, it's going to win, but it's not going to win easily. We'll put up a battle. Savannah's she's a scrapper. She's a fighter. But the journey it's been at times challenging. with everything in life, again, from just to get her up in the morning, to getting her dressed, to getting her fed, to getting her medications, everything's a challenge. Just like when one of the first things that when I see a falling star, every wish that I make every time I see one is that I want my baby to be healthy, to wake up one day and it's healthy. As her dad and primary caregiver, it doesn't bother me to have to change her pull-ups and her diapers or when she's going through her cycles. It doesn't bother me. That's my job as her dad. Well, not just as a dad, but as a parent. So it's not a bother to me. It's never going to be a bother. And there were some doctors that questioned that, if it was, bothersome for me to change her diapers or I'm like, absolutely not. I'm her daddy. Till the day she passes, I will do whatever I need. I mean, she's sitting here in the sofa and she defecated herself. And it's a few times that I don't cry in public. We never have. But when I got her to the shower and she's had defecate all over her back and she did it 3 times in an hour. And so I took her to the shower and all she did was look in my eyes and she goes, "Thank you, Dad. Thank you." And it just made me lump in my throat because, I mean, what if I wasn't there? What if it was somebody else? I mean, I know that people care about other kids, but they don't care about your kids like you care about your kids. So I'm not saying that, uncles and aunts or somebody that comes up and says, "Oh, I know." No, of course they care, but they don't know. Somebody, it's like me, I've never had to bury a child yet. And that's the one journey that I'm not looking forward to. But I think about it every day. I sit in my recliner and I'm already planning this out already. She passes, I'm going to give me a bottle of whiskey, go to the corner of my deck and just cry myself to sleep, drink myself to sleep and just wake up, dust off and keep marching. And so for the plans I have for her also is that when she passes is to get her cremated. I'm Cherokee, so I want to take her back to Oklahoma, get her cremated, and I want my ashes and I want to spread over that reservation because I want us to be free. No more medication, no more wheelchairs, no more chipped teeth, and we can be free and we can just blow into the wind. And, so I think about stuff like that. I do miss things like when I live Savannah's life through other parents' daughters. When I see them playing softball or doing cheerleader, I'm thinking, what could my baby be doing if she was, healthy? So I miss that kind of stuff. She doesn't miss it. She misses her boys, but I miss that kind of stuff. So anyway.
So in true Ruben fashion, he doesn't cry very often in public, but he makes most people cry in public when he starts talking. So I'm getting comments that people are crying. How was it harder in the beginning when Savannah for you when she got diagnosed, and is it easier now or has it just been hard the whole time?
Well, coming from a family that we were even I'm native, I'm 7% native, a little bit of Spanish and Greek, and my parents were not well educated, so I wasn't there either. So all this stuff it was new to us. It was new to me. I didn't understand the language. I went to places that I was told to be at and do what I was told with my daughter. All I knew was that I didn't want her to injure herself. So I would just like a gorilla that carries the luggage. That's what I do. I am there to support Tracy. She is the spearhead, and I am just there. I'm like, she's the president, and I'm the chief of staff. She wants something done. A doctor's giving us problems. I'm the gorilla that comes in and gets it done because I'm going to hurt your feelings. I'm not worried about your feelings. My thing is the safety and the well-being of our daughter is my main. Well, and even if it was a special needs child, I'm there. I remember one time we went to a canine assistance and one of the moms had brought their son and he was 20 years old, paralyzed from the chest down. And she had brought somebody with her other son to help her while he defecated his diaper. And she asked me if I wouldn't mind. And are you kidding me? And she apologized. He was apologizing because of the smell. No need to apologize at all. So if any special need child, adult, whatever, ever needed help from me, you need me to jump on top of that counter and kick stuff off to get something for you that I can do, I'm kicking that counter and I'm going to kick stuff off the counter to try to help you if I can. So,
what advice do you have for our families you've been living with LGS now for 25 years like I have, and I think you must have an amazing wife. I'd love to meet her.
Uh-huh. Right.
What advice do you have for other dads out there, you being the only dad on this panel right
now? I'm not too much on stats, but I think like 90% of parents who have special needs kids end up in a divorce. And I'm just not, that's not me. That's not, it's challenging. Yeah, you have to adjust your whole schedule, whatever it is. You have to adjust your schedule. Yeah, you have to be flexible. You're going to get frustrated. But it's old, but it works as patience. I mean, these kids didn't choose to have this disease. They didn't choose that. So at times you have to understand that their minds are wired a little bit different, and you have to adjust to them. You may be the adults, but sometimes they really can't communicate to you as well. But they know when their bodies are hurting or when they don't like something, they're going to let you know in their own way, and you have to be patient with that, whether you like it or not, and go Raiders.
Thank you, Ruben. I love you.
Mm-hmm.
All right. Well, so you heard from Ruben. If you have any questions for Ruben again, I mean, I hope that it's so hard to tell your story, and it's the old cold hard truth of what we're living with is life or death, and it's, challenges of our kids. And so I hope that, I invite all of you to breathe. If this is hard for you to talk about and think about, just take a deep breath and let's move on to our next amazing speaker, Brittany.
Hello.
Brittany, welcome. Thank you for being willing to share your and Anne-Marie's story with us. Why don't you tell us a little bit about your LGS journey?
So my LGS journey, it started, I was young. I was 19 when I had Amari, and we started out, she started to have her first set of seizures at 2 months. It was right after she had some vaccinations done. And I didn't know. It was so hard. I used to just look at her. And I remember when she first got diagnosed with infantile spasms, I'm like, just give her a medicine, okay? Like seizures are common. Just give her something. And it wasn't that easy. And it was a learning and growing experience for the two of us. I felt like I was growing as she was growing. And then at 3, when she was diagnosed with LGS, it was even tougher. I knew that we may go down this road. I know our doctor had said maybe she'll get Gervais, maybe she'll get Lays or Krabbe's, and then it was LGS. So it was very hard for me because I come from a super active, healthy family, and Amari was the first to have something wrong. And so I had to try to teach my family, and I couldn't teach them. And so we had to leave my family behind, because I remember one of my close family members had said, my blood doesn't produce sick children. And so I had to leave them behind. I left behind most of my family and had to do it by myself, because I had to be that strong, that strength for her. She needed me, and I had to be there for her regardless if I had my parents, my family behind me. I had to be her advocate, and that's what she helped me every single day. Like Ruben, I go in there and I have probably about 3 cameras on her and a baby monitor on her every single day. And I check that every single morning. But the greatest joy is when I go and check in, and I go in there with her and I see those big brown eyes and she's looking at me, and I'm like, oh, okay, hello. And so that's a joy for my day, that I can see her eyes, because there were points where she was on life support and I couldn't see her eyes, or she was in a coma and I couldn't see her eyes. So just being able to see her eyes every day just helps me to go on. And I know that nothing that goes on my day is going to be half as crazy as what she's going to go through in her day. So that kind of like motivates me to go on, because I know that she's going to go through pain. I know that she's going to have her 20 plus seizures a day, but whatever I'm going through, it's minor compared to her. So our journey has been a whirlwind. It's been a gut punch most days. It's been tiring. I spend a lot of time crying in the shower at 11 o'clock at night, and I have to get up at 3 o'clock in the morning. I work a full-time job. I work 50, 60 hours a week, but I know that I am doing it for her. And I know just to see those big brown eyes looking back at me every single day is my true motivation.
Brittany, you shared with us earlier that you have been single parenting since you were really, really young. And so you've been taking care of Anne-Marie all by yourself. Can you tell us what that's been like and how you've learned to manage that?
Oh, man. So it taught me I had to truly learn how to love myself, to be that foundation for her, because not having anyone to turn to and ask advice, or not having that support there. Some of I would say my darkest moments in life came from being alone in a hospital room and looking at her and hearing these machines going off and seeing couples come in with their child and me just being alone. And those were some of my darkest moments with her. And being a single parent is not having someone there to hold on to, someone to hug you, or someone to hold your hand. And me not being able, with Amari being nonverbal, and her being she can't talk back to me, and I can't like bounce the ideas off of her. And so it has been a struggle. It has been truly, truly, truly hard, but with it, I learned how to love myself. I learned how to be that strength, my own strength. Like I said, there is times where I'm in that shower bawling my eyes out and like blasting Beyonce, like Single Ladies, like I can do it. So I have those definite moments, and I just had to learn how to have the strength within myself.
You are amazing. I don't know if I could do it. We've been so lucky that Ruben and I are still together. Not that there haven't been challenges, and there haven't been times where it's like, what are we even doing? But to strike it as a single parent and to be resilient and to keep going. We have a lot of single parents in our group, probably a lot that are listening now. What advice would you give them?
To always just know that child is, Amari feels me. If I'm sad, she feels that emotion. She feels it all. So I try to keep that away from her. Just know that you are, and you have the strength to go on. You have the strength to just be a great parent, that you can do it on your own. I know sometimes with dating, because I've dated and I have met some incredible men, but they may have been great for Amari, but not great for me. And so just know that your Ruben is coming. Everyone, I was looking at the comments, and like, everyone wants a Ruben. Your Ruben is there. You will find a Ruben out there. Tracy, you have lucked up to find Prince Charming and Ruben. I wouldn't, I don't think you would call him Prince Charming, but
I don't think anyone on the planet has ever said your Ruben is coming, but he is he is a good man and a good dad, and keeps us laughing all the time and drives us crazy. But we love him so much. So
he inspired me the last conference. His he just has this strength. He's a bulldog, and he helped me with a couple situations, and he's just that toughness that sometimes that you need in that advocate. And I know Ruben helped me to be more of a bulldog. Even with the incident with her stroller, it was Ruben that's like, no, you do this. And so it's just having those people around you that may not be your family, that may not be your blood, that inspire you, that help you. They don't know if they're helping you. I'm pretty sure, Ruben, you didn't know that you helped me, but you did. You gave me an inspiration to be a bulldog for Amari, to be angry, to jump on top of counters, and to be more of an advocate. And so just having just people around you, leaning on those people around you to inspire you to go on.
Yeah. And I just want to add, I mean, that's a perfect segue. So last conference that we had in Seattle, Emery's chair, her wheelchair, which she needs, she does, it's not a luxury. It's like she needs this to sit up and to be mobile at all, was broken by the airlines. And so I think that, Brittany was just feeling really, and she saw it being broken out the window as it was happening. And so Ruben was able to help her. And this is our family, Brittany is one of our ambassadors at the LGS Foundation. And this is the kind of like support and help that we all offer each other because we are family. So thank you, Brittany, for sharing and stick around because there's going to be questions. You too, Ruben, you don't get to leave yet. So. All right, let's go to you, Emma. Welcome. Thank you so much for being here. Emma is here from all the way across the pond. She is in the UK. Where are you exactly, Emma?
I'm about 30 miles west of London.
30 miles west of London. And what time is it there? Do I want to ask? Is it?
It's about 20 to 9.
20 to 9. So not too horrible. Okay, good.
It's not bad or anything. It's fine.
Thank you so much for being here. So Emma is one of our really good friends from our larger extended family in the severe epilepsies that we call the Really Crappy Seizures Club, because we all of our children, they don't all have LGS, but they all have really crappy seizures, and we're all have different foundations or different organizations or different Facebook groups. So she's from Hope for Hypothalamic Hamartoma. Her son Charlie, who she's going to talk about, has HH, which is it's so much less of a mouthful that way. Emma, will you, so thank you for being here and representing, HH and also the European perspective. We have a lot of families from Europe that are attending this conference and that are in our support group as well. So thank you for being here. Tell us about your journey with HH and tell us about Charlie.
Gosh, well, Charlie's 19 now. HH is a congenital lesion of the hypothalamus, which causes epilepsy. A very subtle epilepsy, really right from birth in most or many cases. I'm ashamed to say I had no idea that Charlie was suffering any form of seizure or epilepsy until he was 7.5. And that's something that causes me, I heard in the last session talking about guilt. That's something that I find difficult to live with because again, Ruben was saying he comes from a family where he was having to learn the language and educate himself. I would always like to think of myself as educated. I have a college degree, not in medicine, but I like to think I understand the world. And I had this child who had problem after problem, who was nonverbal, whose milestones were delayed, who would shake his head, who would go and run around the room for no reason, who would go and grab lavatory paper and rip it into tiny pieces and shake it in front of his eyes and look at it. We had a series of different diagnoses starting at 18 months when he was said to have hearing loss. So we had grommets put in his ears. Then by the time he was 4 and he was still nonverbal and still sleeping maybe 2 hours a night, we had a diagnosis of childhood autism and ADHD. It was only when he was at school in an autistic unit, which was fantastic for him, I have to say, that one of the teachers kept returning to his laughter and said to me, he's laughing all the time. And I said, well, I know he is. He's done that since he was as long as I can remember. And she said, but it's different to the other children. I said, well, we've been told it's a behavioural manifestation of autism. She said, it's just not like the other children. And I remember that evening typing uncontrollable laughter and autism into the Google search engine. And for the first time, I came up with the phrase gelastic epilepsy. And that led me to hypothalamic hamartoma. So I went back to the pediatrician, asked for an MRI. He said it was highly unlikely, but he ordered an MRI. Up until that point, we'd been refused MRI because of the need for anesthesia. And the diagnosis came back. And it was at one moment shocking, and at the same time I felt, gosh, I've got an answer. Now I can do something about it. Now I know what this thing is. I can attack it. I can actually help. But our diagnostic odyssey, a phrase I've heard lots since, didn't stop there. We were referred to the leading paediatric hospital in the UK in London, Great Ormond Street. The neurosurgeon I met there, disputed diagnosis, was very abrupt, very rude, did not appreciate a mother having essentially Googled the answer, was very dismissive about that, felt affronted that a mother with no medical background might think she knew better than a neurosurgeon, doctors. So that was difficult, trying to get around his hubris. I ended up, my husband and I, we were together then, sent Charlie's scans to 3 leading centres in the world. One was in Melbourne, Royal Children's Hospital. One was in the Barrow Neurological Institute in Phoenix, Arizona, which is how I met Lisa Sobey, who's, you know well, Tracy, ex-president of Hope for HH, still heavily involved, co-founder. And also Marseille, where they had a centre. And all 3 expert teams, free of charge, reviewed Charlie's scans, and all 3 said he had a hypothalamic hamartoma. So I went back to the paediatric neurosurgeon at Great Ormond Street. He said, no, they're all wrong. He's got autism. Go home, have a gin and tonic. Thank your lucky stars he's in a special school. Focus on your other children, your other child. So I asked for EEG. That just showed slow wave background, nothing else, no spikes when he was having his gelastic epilepsy. I didn't know at the time that that was part of the cause. I then asked for a genetic test because 5% of HHs are caused by a syndrome called Palliative syndrome, which is a mutation on a gene called GLE3. Charlie came back, he didn't have Palliative, but he did have an amino acid substitute, a mutation on the same third of GLE3. So for me, this was all part of the jigsaw fitting together. He had a mutation on the same gene. He had a small lesion, which 3 experts said was HH, 1 disputed it. He had gelastic epilepsy, which may have been consistent with autism, but it was also consistent with seizures. So in the end, we took the risk, and I took him to France, where he had gamma knife surgery with Professor Regis in the Timone. He had done 100 gamma knife surgeries. There had been probably 50 done at Barrow at that time through gamma knife. The Brits had done 4 at that time. But in any event, the Great Ormond Street neurosurgeon wouldn't refer Charlie for surgery because he didn't have HH. And before we left, he called my husband in and he said, if you let your wife take your child to France, that Frenchman will destroy his brain and I will be left to pick up the pieces. So we had that in the back of our minds when Charlie was being wheeled into the gamma knife radiation room. All I could think, and I would remember it because I was wearing a bright red dress because Charlie loved me in red. And I must have looked like this crazy woman because I was wearing a red sundress in this hospital because it was Charlie's favourite dress. And he was he was sort of verbal. He could put 2 or 3 words together, but he never ever used I. It was never, may I have, can I have, I want. It was Charlie wants this, Charlie needs, Charlie. And the first time he ever used the I pronoun was when he was being taken into the gamma knife machine. He said, Mummy, I'm scared. I don't know how I didn't burst into floods of tears there and then. And I could just hear this man in the back of my head, you're destroying his brain, you're destroying his brain. Anyway, it didn't destroy his brain. I think the hamartoma had already done a good job of that. Charlie's seizures were dramatically reduced after that gamma knife surgery. He started to sleep. Sleep was a major problem. I didn't realize how major it was until actually he started to sleep, how much we'd missed over 7 years of just not sleeping, doing different shifts. I would do a bit, then my husband would be woken at 2. He would lie with him between 2 and 5. Charlie might fall asleep for an hour and then wake at 6, and then we'd be back on the merry-go-round. The surgery seemed to help with that. It also helped with the behavior. Charlie had these hypothalamic rages, which is another symptom of HH. And the gamma knife surgery seemed, whether it was that or whether it was confluence of circumstances, age, education, everything, I don't know, but that all dissipated. And so we're left with a 19-year-old who is a charming, wonderful, funny young man, still very challenged by all the cognitive difficulties that epilepsy has caused. He still has many, many seizures, gelastic seizures, or many tics. But he goes to a special college. He is social. The challenge now is independence as we go into adulthood, giving him as much independence as possible. He'll never be fully independent, but if he can have a life where on a Sunday evening, sometimes I will take him to the cinema with two of his friends from the special needs college. So one may have Down syndrome, another one has autism, and Charlie. And they go to the cinema, and it's all Disney. They like Frozen, things like that, which is handy because I've got a 7-year-old daughter. So we go along, we get a ticket. The 3 teenagers will go and sit 2 rows down. I will sit 2 rows back with my 7-year-old daughter, and we'll all watch the film together. But they will feel at 19 that they're doing something independently.
Yeah. That is amazing, because I don't think I would have the courage to do that for my own Savannah, right? You know, I think there's so many things that strike me about your story, and we're getting comments in that your mother instinct is so strong, and that this is an amazing story. But it's incredible that how similar that journey is, right, to the journeys that we all go on when we're dealing with rare epilepsy and rare disease, where it's like the issue of doctors not believing us as parents or mothers, or giving us how many of us have had our LGS kid or even, I don't know if this happened to you ever, but they're not going to live until their 5th birthday, right? And so, and going on this diagnostic odyssey, and then trying to map out treatments and searching on Google. And so I think you really captured that story really well. And it resonates so much with just me on our own journey to find out that Savannah had a genetic form of epilepsy, right? So thank you so much for sharing that. And we have some questions coming, and we're going to ask at the end. So please stick around. But I want to just say a couple of things. First of all, so you might see some of the cameras going off and people disappearing. It's because everybody is at home with a kid with severe epilepsy. So if somebody needs to walk off or if you see a kid coming in, we told all of our speakers that whatever it takes. We have 3 more speakers, and I know that this is a lot. Just take a moment to take a deep breath here. But this next one is Shay, and she has been adopted by every single one of the parents on this panel. We are in love with her because she is a sibling, and she is going to talk about her brother, Devin, and tell us what her experience has been like. And it just warms my heart. And I'm already going to start to cry, and she hasn't even said anything. She doesn't even talk about, she just is just incredible. Shay, thank you so much for being here. Will you tell us about the journey that you've been on and about your brother?
Of course. Thank you for having me. So my name's Shay. My brother Devin was diagnosed with LGS when he was 5, and he turns 15 next week. He had infantile spasms when he was younger. He's mentally delayed, so it's kind of like having a permanent 5-year-old in the house, which can be very fun sometimes. I was really young when he was diagnosed. There were lots of hospital visits and doctor's offices. But when I got older, I kind of started to understand it more. I did a lot of research on my own. And I actually did a speech on LGS and what to do when someone has a seizure in college. So I taught my whole entire class, what to do, the different steps. And I wrote quite a few psychology papers on it as well. So it's influenced my education a lot. I was homeschooled, so I kind of got to choose what I wanted to learn about. So that was really cool. I always found the brain interesting, so I think Devin helped with that because he had a very strange disease. So learning about that was really cool when I was younger. But yeah, he's a great kid. And I'm really blessed to have a brother like him.
I know. I'm already crying. And your mom's cheering you on from the sidelines over here, saying that you're amazing, of course. what has it been like for you as a sibling when, and don't answer this if you don't want to, but when Devin is just really needs attention and time, have you ever, has that ever been frustrating for you or scary for you? I mean, what's it been like for you as a sibling?
Well, he's a very lovey kid, so he snuggles with us 24/7. So I think that definitely helps a lot because he's such a sweet kid. He does do little things that annoys us, like he takes our cords, like our charging cords. So before I hopped on this Zoom, I couldn't find my charger anywhere. So we looked all over the house, tried to find it. So it's just little things like that can be annoying sometimes. We call him a shark. So like if we have a party or something, or friends over, we have to watch our food because he'll walk around and he'll wait for somebody to not pay attention and he'll go and he'll steal their food. So it's always kind of funny. But I think it's just like with him, it's really easy because he's so like sweet and he's very lovey. So it's always nice like that.
What was it like when you were like in high school and you were bringing friends around, or maybe you didn't bring friends around? I mean, were they really accepting of Devin, or were there, was that ever hard for you, or were you just like, hey, this is it, accept it?
So like I said, I was homeschooled, so I didn't really bring friends over as much, or like the friends I had grew up with him, so they all knew him and kind of grew up with him. But like when I brought my boyfriend over for the first time, I had to warn him. I was like, listen, he'll probably come sit on your lap. He'll probably come give you kisses. So you gotta just roll with the punches. So it's interesting, but it's nice that he's so sweet because all my friends love him.
That's awesome. When you think about the future, with Devin, what kind of things do you think about for you and him?
I don't know. Sometimes it's scary, but I honestly don't really think about it very much because I don't know. I don't. What?
Just enjoying right now with him, right?
Yes. Yeah, definitely.
I think that's a really good lesson. I think that we learn a lot from Savannah and from other kids is that they're very much in the now, right now. It's like she doesn't worry too much about the past and she doesn't fret too much about the future. She's just like, how much fun can we have now? And who's here? And she was
There's always so much going on. Yeah. It's one thing after another. So yeah, you take it a day at a time.
A day at a time. It's a great advice. And we had, it was so nice to see all the siblings at the dance party last night as well, all dance and having a good time. So you are just such an inspiration for us, I think because you as a sibling are just so sweet and accepting. And I know it's been hard. But you just love your brother and are going to do whatever you can to just make him part of the family and accept that. And sometimes the siblings are the absolute best part of, some of these panels because as parents, we carry so much weight and guilt, and the siblings come in and they're like, I just love my brother. They're the best. And teach us, you teach us how to, as parents, how to really just love them unconditionally, which we do, but we also worry. We just worry so much. So
yeah, I don't have to worry about the medical side as much. My parents do. So I think that helps a lot.
That does help. And your mom is still over here cheering you on, and we do have some questions coming in, so stick around. Well, hey, I'd be doing the same. And then you have officially been adopted, so you've got 5 other parents that are on this year that have all just are like, no, Shay's mine. And so, just so you know.
I'll come visit anytime. I love to travel. Come play with your LGS kids.
Perfect. We love it. All right, well, let's go on to our last 2 speakers, last but not least. And I hope you guys are realizing that these are the people that are really helping us and to get through to the next piece. Actually, Shay, we have a couple of more minutes. I wanted to ask you, though, what advice do you have for any other siblings out there?
I think just spend time with your sibling. Like, Devin loves going in the pool, So I take him in the pool all the time. He loves watching Cars. He had that movie memorized. So we watch Cars all the time. He did horse therapy when I was, I think, 13. So I started helping out at the horse farm. I trained the horses. I worked with the kids, and he was there, and he helped me brush the horses and just, like, spend time with them. Find something that they like to do and do it with them. And I think that helps a lot, 'cause being with them day to day. Just doing things they like.
That's great advice. Thanks, Shay. All right, let's go to Kim now. Kim, thank you for being here and for being willing to share your story. And why don't you tell us a little bit about your LGS journey?
Oh, thanks for letting me have an opportunity to share. So I have a daughter. Her name is Kylie. She was diagnosed 10 years ago with LGS after infantile spasms. For the first few years, it was a huge learning curve between Kylie's daily seizures, developmental delays, appointments, therapies, more than I could count. I look back now, I'm thankful that we had all the early interventions, like the early preschool and speech therapy and OTPT, just to try. Kylie did have that autistic feature where she wasn't using her eyes, and she just talks with her eyes, being nonverbal. So it was great that we got that therapy in. One thing though was, for me, with all of that going on, I never got the time to process what was happening with my daughter. With the seizures, like, I didn't have time to grieve for a illness I'm going to have for my daughter for the rest of her life. So that was difficult. Currently, Kylie's doing great. She attends typically a medical fragile school. This year we are doing it virtually with COVID. We had an option, and our option was to keep her home. It's going well on most days. I work full time, and I have another one at home. He's 15, doing high school from home as well. So it's been busy. Kylie right now found one of her favorite talents is jumping on a trampoline. And so far, our LGS journey has definitely roller coaster events, but we're doing good.
I love seeing Kai jump on the trampoline, because you have like one of those what are they called, like fences that go around it, like a barrier, and so she's just in there doing her thing and having a blast. It's so great to see her on Facebook when she's jumping around.
Yeah, it's her happy time.
Yeah, it is her happy time. So how has it been on the treatment journey for you? Have you found anything that's helped with the seizures? Do you have any control at all?
So Kylie has no control. She averages 1 to 3 seizures a day. Treatment-wise, I think we're sitting about 12 medications, some of them being reused in different combos. She's usually on 2 or 3 medications at a time. Currently, Kylie's on 2 meds and treatment of IVIG, intravenous immunoglobulin, every 4 weeks, which keeps her nice and healthy. I call it her liquid gold. We do see an increase of seizures if she is off it. She was off it for a year out of the time that we've been on it. And we're always looking for the new medications, and we're really excited yesterday for the conference about all the treatments. Kylie's had a corpus callosotomy in 2015 when she was 6 years old, which helped with the drop seizures. And a few months later, that came along with a new seizure, was the tonic myoclonic seizure with a scream. And those are her typical seizures. They last about 30 to 45 seconds. Emergency meds have never really worked for Kylie, so we currently load her with an anti-epileptic when she starts clustering. I think that's it for treatments for her.
You're still on the treatment odyssey, which comes after, well, sometimes it comes before the diagnostic odyssey, because you get a syndrome, right? Like epilepsy or LGS, and then there's the cause. Do you know the cause of the seizures in Kai, or are you still looking, or do you not want to know? Or have you stopped looking? Because some of us just stop looking after a while because we're tired.
Yeah, so we definitely haven't stopped looking. But unfortunately, after 13 years, we still do not have a diagnosis why, a cause. Kylie's sitting in that unknown cause. We've heard about an autoimmune disorder, but there's nothing really to diagnose her with. So right now we're currently still investigating genetics. We've done the genome and exome testing, but Kylie's in other studies that are active, and the metabolic and genetics at Alberta Children's Hospital just put her name in, and anytime they have a new study, they just look for my consent, and I'm willing to sign any paper share her samples with people.
Yeah, that's great. I think that there's a lot of us that have been there where we're just sort of waiting for the next thing, because we just want the seizures to get some amount of control, because you never know what you're going to get, right? It's like, oh, the average is 3 to 5, but that might mean that was 500 one day, and then it's
then there's one, and then we have 3 days.
Yeah. So what advice would you give to other caregivers that are on the call? Do you have any tips or tricks? And it's okay if you don't have any, because we all need support. But any tips or tricks that have helped you to live with this?
Daily is take it day by day, and if you even need to take it by the minute, take it by the minute. For Kylie, so she has some mobility issues, so she's a real safety concern. So take an 11-month-old baby, but 100 pounds, her room is safe. So when I was a teen mom with my oldest son, my mom had always said to me, if you're not comfortable or you need that time, put the baby in the crib. Step away, come back, and start over. So for me, with Kylie, her room is safe. If I need to put her in a room and take those 10 minutes, 5 minutes, 1 minute to sit somewhere else, I do that. And it's worked great. I've used that since my kids were little.
That's a really good advice. Thank you so much, Kim. We're going to go to Gloria now, and then we're going to see if viewers have any questions. Thank you so much. All right, Gloria, thank you so much for being here and being willing to talk about your story with Jacob. You are last, but absolutely not least. And why don't you tell us about your LGS journey?
Well, thank you for having me. And it's really amazing listening to everybody. I feel like we're so connected because we've all gone through this journey, and I can relate to everything everybody was saying. So it was always kind of hard for me because of our situation, and I don't want people to lose hope, because we survived 19 years on hope. So Jacob earned his angel wings. I like to say he earned his wings. He didn't pass away. And he's free. And he earned his wings on November 14th, 2017, after a hell of a year. It's hard to go back to the beginning because it seems so long ago. But the year that he was in status and thousands of seizures a day. So we spent most of that year in Children's Hospital of Philadelphia. We put him in a medically induced coma. The chances of him coming out of that were pretty much slim to none. But we kind of followed his lead. He too was nonverbal, but the fact that he was maintaining good vital signs, we just kind of followed his lead. And I learned so many lessons during this 9-month period. He did get through the medically induced coma. He did get to the point where we actually went home after about 4 months. And seizures we took a little seizure vacation. But the meds they put you on are so toxic when you're in a medically induced coma that all his other systems started to shut down. But he really taught me in this time period that he's here. He and all of our LGS kids are here for a much greater purpose. They're not here for themselves. They are giving up. They are giving of themselves so selflessly for us to learn lessons and for us to get the biggest gift. And I am able to take those gifts that he gave me just to appreciate his smile and his open eyes and the fact that he loved just holding your hand or listening to Raffi on the radio or reading a book and looking at the sunset. You know, these are all the things that are really important. It's funny because my husband and I always said Jacob's care was complex and everything around him was complex, but he was simple. But as we were going through this journey, I might have said that, but I don't think I believed it, because I too was always trying to find the next medication and the next treatment and the next hospital, the next doctor and the next school for what was best for Jake. But if I would have just sat back and listened to him and, you know, let all of our lives just be simple, I can't go back, right? And I don't feel guilt, which is amazing. And I think that growing and learning and accepting and being open to the gifts that he's given me, I don't feel guilt. But I do wish that I learned sooner. You know, I really wish that I wasn't so caught up in everything else. And like documentation, I have boxes and boxes of documentation. And I just wish that I had one less box so I know that I had more time, you know, to spend with him. So if I had to give you any advice, it would be to just take a step back and enjoy your children for who they are, because they have so much more to offer you. You know, they ground us. My daughter's calling me right now. And when I think of him, I just smile because he graced me with his gift. And we put a bench in his favorite park, and people go visit it, and teachers go visit it that I haven't talked to in years. And, you know, they'll see the bench and then they'll send me a picture of them at the bench. And it's just like, he's still touching people. And it's just really so important. And as I'm going on and on about Jacob, I just have to add in one other thing. My grandson also passed away. 3 months before Jacob, he was 14 months old. And he was born with 2 mutations, Otahara syndrome and atypical Rett syndrome. And I had Jacob and Evan both in the PICU in 2 different states, one in New York and one in Pennsylvania, at the same time for 6 months. And if it wasn't for the palliative care team at CHOP, just coming in and taking over and having one-on-one sit with Jake so I could run to Syracuse. The palliative care team that you can reach out to is just like a blessing. They're angels. And they're not there to help you through the last days. They are there to help you with your child with a chronic, fragile medical condition. So if you haven't already looked into that, you need to. Because I don't know how I would have gotten through, you know, life without them. And I wish I had met them sooner. So, and one last thing, when Jacob was once we found out he had a static encephalopathy when he was 6 months old, we went through genetic testing, and my husband and I, we wanted to have another baby. So they said it was a 25% chance of something happening, but we did it. And Hallie is wonderful. She's 19 years old now. And like you, Shay, she embraced her brother. And that's all she knew. That's all she grew up with Jacob, and it's all she knew. And she wrote her college admission paper on Jacob, and every paper in school was on Jacob. So, she's going to continue his legacy. But my oldest son, he's the one who had Evan, my grandson that earned his angel wings. She told him, go outside of your gene pool. Well, she didn't tell him. She told us, because he was little. He was 10 years older than Jacob. Go outside of your gene pool. That is your best chance for not having a child with anything. So I'm happy to say my son married a girl from China. They met in college. She came here from China. And they had Olivia, who's 7 now. Then they had Evan. And Evan, he was a 1%er. I mean, not even, maybe a 0.1%er. So you wonder, I don't want to say God, because I'm not really, I'm religious, but I'm spiritually religious. And, he went out of his gene pool, and then he had this beautiful baby, Evan, who, knew nothing else for 14 months and really suffered. But it brought our family together. How do you find a reason for why this baby was here? And then Evan passed away first, and then 3 months later, Jacob came to hold his hand. So,
that's so brave, Gloria. We're just getting a lot of comments about how brave you are for sharing your story. And I think all of us, we don't back down from the tough issues here, as you can see by this panel. We're not here to sugarcoat LGS or ADH or any of the epilepsies for anyone. But what we do have is support. And somebody was asking, how do you find a palliative care specialist? And you can now share that with all of us. And I just want to say 2 things before you answer that question. The first is, thank you for sharing your experience with us and helping us to know that you're out there if that should happen to us, or if we get there, if we need to know about palliative care specialists. But I also want to say that you and all of our bereaved families are forever a part of this community, and hope you always feel that you have a place to come, because we get it. We're here for you, and always will be. So
thank you.
Tell us about palliative care specialists.
So I did also not mention, and I'm sorry I bop all over the place, but the brain is just going in so many directions.
We get it. No sorries required.
So Jacob's LGS was secondary to KCNB1, which I know they do have on the exome panel now.
Yes.
But they didn't when we got it. So it took 2.5 years to get the diagnosis. But palliative care, typically any children's hospital in your area is where you would find your palliative care team. So, we're lucky. We're one of the best hospitals in the country. And when Jacob was in status, they came to us. I was disappointed, though, that I had to look for this, that they hadn't come to me sooner. So were we lost in the system? I don't know. But the palliative care term is kind of scary to a lot of people, right? But it's something that having a child with an uncontrolled epilepsy, you just at some point have to take on. Somewhere down the road, we decided, okay, it's not seizure control, it's quality of life. And then somewhere down the road, you have to say, I need all the resources I need to have this quality of life, because quality of life looks different for everybody, right? Jacob regressed a ton. I mean, he was, at 3 years old, he could sign, he had 36 signs. He walked. He went to school with an aide. He fed himself. He could drink, everything. But by the time he was 16, 17 years old, we were in, a wheelchair, and he got a feeding tube when he was 8. Everything just regressed because his brain wanted to seize. And we did have a neurogeneticist tell us his brain wants to seize, so it's going to do whatever it can to do that. And I think that's really what kind of where I changed my focus, that, you know, this is really a quality of not life issue, not a seizure control issue. And for some families, it's easier than others to be able to handle that.
Thank you. I want to open this up now, and I want to give other people a chance to answer. So if you can unmute yourselves and then just raise your hand if you'd like to answer this question. But kind of keeping in line what Gloria just said, how is it, you know, it's about quality of life. So do you have any do-it-yourself tips for how to keep your loved ones safe and entertained and happy? I mean, it's so hard to figure that out. So what have you guys learned? Just raise your hand and we can call on you, but everyone can answer if you have something you want to say. Anyone want to go first?
I'll go first.
Okay, go Kim.
So we're avid campers. We go out to the mountains all the time, dirt biking, quadding. We even went to Alaska last year. But one thing for Kylie, she's not safe, so we need a safe environment. So we bring a big cabin tent for her with an air mattress, and we mimic her bedroom in this huge tent for her. And she enjoys it, and we're outside, and it works great. So it's like quality of life. We're being a normal family with some adjustments.
I love it. Emma?
I think that that's also key, trying to be see yourself as a normal family with adjustments. And we do the same with Charlie. We worked out very early on that he does much better outside with the space. So it's, even if it's just time in the garden, but very early on it was trying to exhaust him and exhausting us as well by taking him to parks all of the time. And when he was younger, he wasn't safe, he would run off. So you would have to follow him. As he's got older, he is safe now. He wouldn't run into the road. But it's just we have a dog, walking the dog. He loves swimming, but he seems to get a sensory sensation from being underwater and holding his breath. So he doesn't tend to swim, although he can, so he's safe in a pool. But he will dive into the pool and then sit on the bottom for as long as possible. And it's making sure, obviously, that the lifeguards recognise him. He's fine. He's caused a few scary moments in pools, but realising that that's okay. He doesn't have to swim lengths like everybody else. He can go and spend 20 minutes doing that, and then we jump in the pool and play games all together, and then he'll join in. So it's giving him his space within a family environment to do what he needs to do that's different, but then bringing him back into the fold at the same time. And so it's family life, but with adjustments. I think that's
I love that phrase.
I love that phrase. Yeah,
I love that phrase. I know, just for us, just exactly where I just feel like I just really want to share that for us. It took us a while to find, like, we're taking Savannah to Special Olympics and basketball and gymnastics, and we're taking her to therapeutic horseback riding, and first of all, we faced a ton of discrimination at those places because her level of intellectual ability is not like at the level of a Downs kid's, which is much higher. She's very, very young. And they're like, she's not trying. It's like, she doesn't understand what you're asking her. But also, she just was expressing in her behavior that she did not want to do this anymore. And so we've had her at home, and she just wants to be in her little space playing with her stuff. But we just got a used Wii, and it has dancing videos on it. And she's just been at that every day, for like over an hour. And it's like, that's the thing. And then I can go do it with her. And just so you know, Just Dance Kids for 4-year-olds kicks my butt. I cannot do Itsy Bitsy Spider, but it gives us that time. But it took us so long to find it. So it might be trial and error. So Gloria?
Mine's a little, so whenever Jacob was having like a seizure-free day, I call it a seizure vacation or something like that. If we had doctor's appointments and therapy, I canceled it. Because today was like a day to just be. And I just, yeah.
I love it. Normal with adjustments and just be.
Yep.
So what about, and this is for you, Ruben, too, I want you to get us started, but any advice how to get our kids to do the things that they just have to do but they won't do, like wear their helmet and, sit down to be safe if they don't have their helmet on, or take their meds. And I know Ruben has a great medicine story, so I want him to share that. How do we get Savannah to take her meds? How do we?
By force. I'm kidding. No,
you got to watch what you say.
Yeah. No, what happened was with her was we were in I forget, we were in Australia or Italy or something, and my sister, that's a CPS retired worker, she's more patient than I am, but she goes, hey, I have a battle with her taking her medication. So I said, well, use whipped cream. So we started using whipped cream, and now she's all with her hands, and she'll take them, but now she's kind of stopped. So what I have to do is she makes me smell her armpits. So I have to smell her armpits one at a time. Then I got to do them together. And then I have to pretend like I'm gagging and coughing, and she's just giggling, and she opens up her mouth, and I toss the pills down there, the whipped cream, and she said, Dad, smell them again. I said, oh my, so yeah, it works. And then what happens is we have our neighbor, she loves boys. And I will tell you real quick, these seizures have saved me from going to prison, because if somebody was to hurt my baby girl, they're going to die today. But with the seizures, she didn't go anywhere, but she loves boys. So we've had our friends make videos. And there was a lady in Chicago that actually gave me the idea about her child with special needs. And so these boys, our neighbors up the street, the boys just tell them, Savannah, take your medicine. And she's all smiling, and so like you're saying, we have to adjust. And she's old enough now where she knows what she wants and what she doesn't want to do. But no, it's those are some of the things that how she takes her medication, or even to get her to wear her helmet is, she doesn't want her parents to do it, but if somebody else does it, it's the greatest thing. It's the best idea. So they'll put on that helmet for her. So our neighbors and our friends that have been around us for years, they know Savannah. And when it's time for medication, and if we're at their house and they're here, we just pass the medication to them, and she takes it, no problem. I'm like, okay, it works.
Well, we only have a little bit more time here, so I want to make sure this question gets asked for you, Shay. From another sibling who has a brother with LGS, how much time did you spend learning about your brother's condition, and how did you go about doing that?
Well, we went to the LGS conference in Orlando, and that helped a lot. I did a lot of research on my own. A lot of the pamphlets we got from the LGS conference, I used those to make slideshows for one of my college classes, for one of the presentations I had to do. But I did a lot of research online. I went to a lot of doctor's appointments with my brother for a while, and my parents, obviously. And that helped too. I learned what a corpus callosotomy is. I learned what different scans do and all that kind of stuff, which I always found really interesting. And right now I'm actually taking abnormal psychology, and one of the chapters I just went through was about the brain. And I was like, oh, I know that. But I did a lot of research on my own, and obviously my parents and my mom helped a lot too, to kind of share what they've learned from the doctors that I haven't been there for. But yeah, I just did a lot of research, and not even just on LGS, but on different seizure disorders and things like that, and what causes seizures, what can cause seizures, because there's so many different things. So I just Googled it, Google Scholar, all different kinds of stuff. So yeah.
Awesome. All that you, because they Google it to know, oh, you shouldn't go to Google. They absolutely go to Google. And I'm a doctor, so I can say stuff like that. So
yeah, maybe not WebMD, because WebMD can be a little sketchy sometimes. Right. But yeah.
But you keep digging and you keep hearing it over and over again, and you read it in the science papers, then you can start to, come to conclusions. So, so we just have like a couple minutes left, and we haven't heard from you, Brittany, in this sort of last round here. So I want to just ask you, you just learned after quite a few years the cause of Anne-Marie's epilepsy that led to her LGS. Can you just tell us a little bit about that and how you're feeling right now in this new place you are in?
It was such a shock. I envisioned that moment for years to get the cause. And like, when she told me, I'm like, what? I thought it was going to be like this big bang moment with fireworks and all of that. But I mean, of course, I am happy to have her cause.
It's a gene, right? It's a
yes.
genetic. Okay.
It's called SLC35A2-CDG. Long. I had to write it down. But it didn't change the way I looked at Amari. It didn't change anything. It was just yes, we have a name to our demon and how it's caused, and we are starting to meet some great people that also their children have the same issue. So, but I thought it was going to be more of a big bang moment, but it was oh, okay, Amari, you have this to add to the laundry list of everything else, but okay, we're just going to go along with it. So, but it's great just to know for further reference and for future children and all of that. It's just great to know and to have a group to now talk to more and in depth.
Thank you for sharing that. I mean, Amory still has LGS. This is still her community. But what we heard from Dr. Worrell yesterday, right, is that as we learn more about the specific causes, the root cause, that in the future, as science evolves and medicine evolves, it could change treatment. Maybe it doesn't right now. I know KCNB1 is a big one where they're studying it really aggressively and trying to find out treatments. But who knows what 5 years are going to look like? And so you've got the best of both worlds now, two worlds to try to figure out. That's so we're out of time, and I just want to thank all of our panelists for being so brave to share your stories and for being so real and so honest. Thank you so much for this. For those of you that were here listening and maybe scratching your head about what just happened and why there wasn't a cry warning on the session, which in hindsight I realized there should have been. This is your family. I mean, if this is your home, this is where you can come and ask these tough questions. How do you deal with being a sibling and not understanding? How do you deal with the fear of death? How do you deal with getting them to take their medicine or wear a helmet? Where do I find resources? We didn't really get a chance to talk about this, but Emma's in the UK, Kimberly's in Canada. We have groups all over the world that are trying to navigate. In this US, how we get services is based on state. So we have groups that are from different states. And so really coming here to try to get the support and help that you need is something that we've done at the foundation for since it began and since it's grown, and we'll always do. So don't ever hesitate to come into our online private support group. And the minute that if we find out that you have HH, we connect you to HH. If we find out that you have SLC 35A2-CDG, I don't know if I got that right, but whatever, we will try to connect you to those people. And so you can really focus on the science there, but also be supported here. So, and we really don't shy away from the tough topics here because our lives are really tough. They are really challenging, and we're not going to sugarcoat it for anybody. But our kids are amazing. They are such a joy. They teach us the best parts of life, and we love them to death. So thank you to our panel, and I am now right on time. I'm going to turn it over